Women and girls are at heightened risk of gender-based violence in crisis settings and humanitarian emergencies. IOM's Gender-Based Violence in Crisis operational framework ensures a comprehensive response centered on supporting survivors, mitigating GBV risks, and addressing root causes. The Women and Girls Safe Spaces play a key role in such efforts, providing essential services and information, psychosocial support, and life skills training for women and girls. These spaces also ensure safe, non-stigmatizing access for survivors of gender-based violence. IOM directly provides case management support as well as a wide range of multi-sectoral services. We also ensure close integration with our protection, child protection, and counter-trafficking teams for specialized support in caring for child survivors and victims of trafficking and engaging in outreach, awareness, and dialogues on these protection risks in the community. These spaces are crucial, life-saving entry points for services and information for women and girls in the community. The COVID-19 restriction measures intersect with a number of GBV risks for women and girls. Today we are in Leyda, in Teknaf, in an area with a lot of complex pre-existing protection concerns before COVID-19, and also a mixed community of old Rohingya from the 1990s, as well as new arrivals and affected host community. Teknaf had a number of pre-existing protection concerns related to gender-based violence, child protection, as well as human trafficking before COVID-19. These are likely to be exacerbated, likely to the lockdown and restriction measures.
Hello, Assalamu alaikum. আমি রুকসানা আক্তার আমি আইএমের সাথে কাজ করছি একজন কেস ওয়ার্কার হিসেবে জেন্ডার বেসড ভায়োলেন্স নিয়ে কাজ করি এই কোভিড-19 সিচুয়েশনে আমরা ক্যাম্পে কাজ করতে এসে আমাদের অনেক চ্যালেঞ্জ ফেস করতে হচ্ছে কিছু চ্যালেঞ্জ আমি আপনাদের সাথে শেয়ার করব যেহেতু একটা খারাপ সময়ের মধ্য দিয়ে আমরা যাচ্ছি এই সময় কেস ফলো আপ করতে গিয়ে সার্ভাইভারদের সাথে মিট করাটা অনেক টাফ হয়ে যায় তাদের সাথে কমিউনিকেট করা অনেক সময় তাদের কাছে মোবাইল থাকে না আর নেটওয়ার্কিং প্রবলেমটাও এখানে অনেক বেশি আর হচ্ছে ইন্টিমেট পার্টনার ভায়োলেন্স এবং সেক্সুয়াল ভায়োলেন্সের কেসগুলো এখানে বাড়ছে এই সময়ে আর রিপোর্টও করতে আসছে না ঠিকমতো যেহেতু তারা ঘর থেকে বের হতে ভয় পাচ্ছে কোভিড-19 সিচুয়েশনের ঘর থেকে বের হতে ভয় পাচ্ছে আর যেহেতু তাদের ইন্টিমেট পার্টনারগুলো বাসায় থাকার কারণে তাদের বের হয়ে WGSS আসাটা তাদের জন্য অনেক চ্যালেঞ্জিং
In line with the recent COVID-19 situation and intersectoral coordination group guideline, IOM Gender-Based Violence team continue to work with the reduced number of staff of 50% and reduce all group of psychosocial activity in their women-friendly safe space. Individual case management and counseling support service continued maintain physical distancing through the women and girl-friendly safe space.
We are also adapting our activities in a way where women and girls can still reach us through this women committee support mechanism. As we know, the GBV risks are significantly increasing during this COVID-19, but not being reported because of the movement restrictions, and also the survivors are not being encouraged to come out because of the spread of COVID-19.
Today I am in Camp 18. We have 10 safe space within 9 camp, and then every safe space we have different name. Today we will introduce with all of you the Shuki Khana. Shuki Khana means happy place where people get happy and then relax and feel more comfortable to here. So this Shuki Khana names by the community people who are coming, the women and girls. So let's do a tour with our Shuki Khana. We have 2 activity room, 2 individual counseling room, 1 life skill training room, 1 child corner, and some other office facilities room in the safe space. This is awareness session room. Today we are going to facilitate COVID-19 related awareness session. In COVID-19 they covered what is COVID-19, what are the symptoms, what can we take preventive measure for COVID-19, and also how can reduce the fear, misinformation, rumor about COVID-19. There are lots of misinformation, rumor and fear related to COVID-19. Women and girls already face many barriers to accessing their information. We are adapting radio listening session with our beneficiaries in the audio materials. In audio materials, there are lots of characters like doctor, Maji, religious leader, and general community member. When they hear their own voice from their radio, they enjoy a lot and they believe their voice when it presented by their own language. It is one kind of strong tool for reducing rumor from their community. This session helps us building trust with the community. Women and girls open face accessing issue to information And so we conduct radio listening session in our safe space. We are going to life skill training room. This is life skill training room. They receive training through implementing partner Pulse Bangladesh. We follow the guideline of WHO and prepared marks as a life skill training part. In COVID-19 situation, marks are more important for every individual. Our beneficiaries receive marks through the safe space and they show their interest to know how to make the marks. They receive training and receive sewing machine through women and girl friendly safe space. Now they come in safe space every day and make marks as a part of COVID-19 prevention. Now they feel proud for them because women and girls told us finally they can do something for their own community. So we are going to individual counseling room. We provide individual counseling service and we followed survivor-centered approach in the case management procedure. We receive lots of gender-based violence case from the community, and during the COVID-19 situation we see new changing GBV trends, risks increasing a lot. For the COVID-19 situation, husband's income source decreasing a lot and they stay at home every time and give restriction to their wife to come in everywhere. Basically, intimate partner violence increasing a lot but report less due to lack of service provider in camp and also reducing the 50% of staff, affecting our quality of care.
Assalamu alaikum. I am Rushni Akhtar, Safe Space Supervisor. I am working with IOM Protection Unit. In this COVID-19 pandemic period, we are providing our best support for prevention by awareness session on maintaining social distance, hand washing, and wearing masks, and eating nutritious food, and staying at home, and prevent violence. Our caseworker also doing case management service among with GBV guiding principle, survivor center approach, and referral pathway on with face-to-face and remote case management service. And our volunteer also doing individual awareness session in community level, and also our PSS officer and our caseworker also doing awareness session in our WGSS indoor.